What are the different types of phalloplasty? If you are curious about the different types of phalloplasty, you are in the right place. Phalloplasty is a surgical procedure aimed at constructing or reconstructing a penis. This procedure is often pursued by transgender men and others seeking gender affirmation or reconstructive surgery. Each type of phalloplasty varies based on the donor site of tissue, surgical technique, and the outcomes related to sensation, appearance, and function. One common method is the tube-within-a-tube phalloplasty. This technique uses a single piece of tissue shaped into two tubes. One tube forms the outer shaft of the penis, while the other creates the urethra, which is the tube for urination. The tissue is usually taken from the forearm or thigh, especially in thinner patients. This method allows for urination through the newly constructed penis and aims to provide a natural appearance and function. Another option is shaft-only phalloplasty. In this case, only the outer tube is created, while the patient continues to urinate from their existing urethra. This method can be combined with other procedures, such as creating a scrotum or burying the clitoris. Tissue can be harvested from various donor sites, including the forearm, thigh, or lower abdomen. For those who may not qualify for tube-within-a-tube phalloplasty, composite phalloplasty is available. This method uses to separate pieces of tissue, often from the thigh and forearm, to create the shaft and urethra independently. The radial forearm free flap phalloplasty is the most common type. It utilizes skin, blood vessels, and nerves from the forearm. This technique allows for microsurgical connection of nerves, which can provide tactile and erogenous sensation. The skin from the forearm is thin and pliable, making it suitable for forming a natural-looking phallus and urethra. Another option is the anterolateral thigh flap phalloplasty. This technique uses tissue from the side of the thigh, including skin, fat, and fascia. The thickness of the tissue can vary, which may affect the aesthetic outcome and sensation. When possible, the blood supply remains attached, preserving circulation during the transfer. Pedicled flap phalloplasty uses a skin flap that remains partially attached to its original site, maintaining blood supply as it is moved to create the penis. Sensation may be limited unless microsurgical nerve connections are made. Free flap phalloplasty involves completely detaching the tissue from the donor site, along with its blood vessels and nerves. This tissue is then microsurgically connected at the recipient site, allowing for better chances of sensation and functional outcomes. Variations include the radial forearm flap and the anterolateral thigh flap. Abdominal flap phalloplasty uses skin from the lower abdomen to create the shaft only. This method does not involve nerve connections, so sensation is typically absent, and patients cannot urinate standing through the neophallus. Lastly, the delayed anterolateral thigh flap is a variation where the blood supply is partially severed, but the tissue remains in place for several months before being moved. This can improve tissue survival and outcomes. Understanding these types of phalloplasty is essential for individuals considering bottom surgery. Achieving a genital appearance and function that aligns with one's gender identity can significantly impact body image. However, the extensive nature of these surgeries and potential complications can also affect self-esteem. Psychological support before and after surgery is important to address body image challenges and any concerns related to eating disorders that may arise from changes in body perception.